Hello everyone, my name is Aldisa Dameitha. I'm a student from LSPI Institute Communication and Business Jakarta under the supervision of Mr. Charles Bonar Sirait as my lecturer. And in this video, I'm going to be talk about bipolar disorder in a teenager and in young adults. What is bipolar disorder? Bipolar disorder is formally called manic depression. It's a mental health condition that causes extreme mood swing that include emotional highs such as mania or hypomania. And when they're low, is such a depression. When you become depressed, you may feel sad, hopeless, lost interest and pleasure in the most activity. When your mood shifts to mania or hypomania, you may feel full of energy or unusual irritable. This mood swing can be a fact for sleep, energy, activity, judgment, behavior, and ability to think clearly. Episodes of mood swing can be occur rarely or multiple times in a year, while mostly people will experience some emotional symptoms between episodes, but some maybe are not experienced. Causes of bipolar disorder. It can be genetics. If your parents or siblings has bipolar disorder, you're more likely than other people to develop the condition. However, it's important to keep in mind that most people who have bipolar disorder in their family history didn't develop it. In your brain. Your brain structure impact your risk to disease. Abnormalities in the structure or function of your brain may increase your risk. Environmental factor. It's not just in your body that can make you likely to develop bipolar disorder, but the factor can maybe contribute to. And there is some factors can include like extreme stress, traumatic experience, physical illness. Does a teenager have a bipolar disorder? Bipolar disorder is commonly begins to show itself in the late teens. Bipolar disorder in the teenager years is more serious. It's often more dangerous than in adults. Young adults with bipolar disorder can take high risk for the suicides. These symptoms of bipolar disorder can be difficultly to identify in children and teens. It's more hard to tell whether these are normal ups and downs, the results of the stress or trauma, or the signs of the mental health problem other than the bipolar disorder. Children and teens may have distinct major depressive or manic or hypomanic episode, but the pattern can vary from the adults with bipolar disorder, and moods can rapidly shift during the episode. Some children may have periods without the mood symptoms between the episode. To be diagnosed with a manic episode, you must experience these symptoms that last for at least 1 week or that cause you to be hospitalized. You must experience these symptoms almost all day every day during these times. Major depressive episodes, on the other hand, must last for at least 2 weeks. What kind of treatment are used for bipolar disorder? Despite the mood's extreme, people with bipolar disorder often don't recognize how much their emotional instability disrupts their life and the life of other loved ones, and don't get the treatment but they need. And if you're like the same people with bipolar disorder, you might enjoy the feelings, euphoria, and cycles of being productive. However, this euphoria is always followed by an emotional crash that can leave you depressed, worn out, and perhaps in financial, legal, or relationship troubles. If you have symptoms of depression or mania, you can see the doctor or mental health professional. Bipolar disorder doesn't get better on its own. Getting treatment from a mental health professional with the experience with bipolar disorder may help you to get your symptoms under control. There are also simple steps that you can take right now to manage your bipolar disorder, such as a supplement, lifestyle change, keep your routine for eating and sleeping, learn to recognize your mood swing, and ask your friend to relate to support the treatment plans. So, don't underestimate your health problems, especially for bipolar disorder in the teens and young adults. Thank you.